All right, Dana, thanks so much. Dr. Zorba Pastor is taking your calls today.
The number to call if you have a question for Zorba is 270-9933. It's a great day to call. The phones are wide open. Dr. Pastor joins us from his clinic in Oregon. Hi, Zorba.
Hi, how are you guys doing?
Great to see you. And while we're waiting for some of the calls to clear, let's talk a little bit about something, a serious issue we discuss every year at this time of the year, seasonal affective disorder, and how you fight that.
Seasonal affective disorder, which goes under the name of SAD. And basically it's something that affects many of us. Why? Because the nights are long, the days are short, things are going to start to turn around, but they don't turn around for a while. And the nice thing about seasonal affective disorder, or SAD, is there are a few things you can do. First of all, there's the non-pharmacological way to treat it, and that's with an SAD light. So if you go, for instance, to Amazon.com and you put in SAD light, you will end up seeing a bunch of lights which now only cost about $30 or $40. These things used to cost $300, but these are LED lights that really work well. They're not very big at all. They're about this big, about maybe half the size of a cereal box. And the important thing is the light should say 10,000 lux, L-U-X, or it should say 10,000 lumens. That's the kind of light you want to get. And what you want to do is put it on 20 minutes a day. You don't have to look into the light. What you can do is you can look at the TV set or a computer. Put the light to the side of you, about maybe an arm's length away, for about 20 minutes, and that can give people more energy. It's a non-drug way to increase your energy in the middle of the winter time. And for anyone this time of year who has it, this is a great Christmas gift to give people. Absolutely a great gift. I use it myself. I don't actually get depressed. Some people get depressed with the winter blues. I just lose energy. I use that light pretty much about 3 or 4 mornings a week, and it's made a huge difference in my life.
All right. Again, it's a great idea for Christmas, like you said.
Yeah, no kidding.
Yes.
All right.
Yes.
We've got a call here. This is Judy from Fort Atkinson. Judy, you there?
Yes, I am.
All right. What's your question?
I'm wondering if the idea of taking ibuprofen is okay if I have had bleeding ulcers, but it was like 10 years ago.
You know, on the whole, you really want to stay away from it. You know, much better to take Tylenol, better to take arthritis-strength Tylenol, 650 milligram tablets, 2 tablets every 8 hours. If you're a non-drinker, if you're a drinker, it's only 1 tablet every 8 hours, and that's if you drink more than 2 drinks a day. That's when you have to lower the dose. If you had a bleeding ulcer 10 years ago, ibuprofen might affect it, and I think that's one of those times you have to sit down with your doctor and say, I had a bleeding ulcer, I have to have something called omeprazole, Prilosec, and I want to take it with ibuprofen, but I'm going to think that most doctors are going to stay away from it because you still run the risk.
All right, very good. Thank you for calling today. Let's go to Sue in Middleton. Hi, Sue. What's your question?
My question is there any after effects of finding out that you've had hepatitis C and that your body has naturally cleared it?
Well, if you've had Hep C and your body has cleared it, one of the things we look at are liver function tests, because you can clear Hep C, but you can still have liver problems. If your liver function test is normal, then most likely the hepatitis C has not adversely affected your liver. Now, there's one more test that we sometimes do, and that's an ultrasound of the abdomen around the liver to look at the liver, or something called a fibroscan, which looks to see whether or not the liver has developed cirrhosis. Either one of the two steps are really a second process to see whether or not your liver is safe. But generally, for the most part, if you've got normal tests and you cleared hepatitis C by yourself, that usually means your liver has not been affected. And once again, if you don't have Hep C in your bloodstream, it's not going to continue to bother your liver. I hope that answers what you're looking for.
All right. We've got a friend from Rock County now, Robert from Janesville. Robert, what's your question?
He answered it. My girlfriend has been coughing for 3 months. And I want it to stop because she gets up at all night and it sucks.
Of course it does. If she coughs and you're with her and you get up all night, it sucks for you. But how can I help you?
Hold on.
Are you still there?
Yes.
So what is your question for Dr. Pastor?
I was wondering if there's anything, because she missed her appointment.
Oh, sure. Well,
Is there
first of
any-
all,
Anything to stop the cough.
If you've anything to stop over-the-counter cough medicine with DM,
I want to know what
dextromethorphan.
Oh, I'm sorry. It just got disconnected. Sorry about that, Zorba.
Okay. Over-the-counter dextromethorphan is something you can give if you have a cough. But if the cough has gone up for 2 to 3 months, it can mean a lot of things. It may be something simply benign. Could be asthma, could be chronic lung disease. That's really, if it's going like that, it's really where you should see a doctor, nurse practitioner, PA to find out what's going on.
If you have a viral...
Over-the-counter syrup, if it doesn't work, you got to see someone.
And if you have a viral cough, can it last that long? It can last a long time?
Sure, for some, but 3 months is kind of on the long time. And once again, it's the history of the patient, and in this case, we don't really know what's going on, whether or not they have other things going on. That's really where a call to the doctor's office can make a difference, and because they know the history, and that's where they can give you the right advice, often over the phone.
Very good advice. All right, we're out of time today, everybody. Thank you for your calls. Zorba, thanks. Good to see you.
Good to see you.
I think we'll see you one more time before the holidays are over.
Oh, good.
So
We will.
appreciate your time. Thank you so much.
We'll be right back. Stay with us.